Welcome back. We've all probably joked at one time or another about laughing so hard you pee your pants, but for millions of women, this isn't a laughing matter at all.
No, in fact, she calls it a silent epidemic. Reinke is a registered nurse from Bellin Pelvic Center, and she works with women every day to overcome this. Good morning.
Good morning.
So let's start out by saying, what is urinary incontinence? I mean, is it frequency that defines it?
Well, it's the accidental loss of urine. It's involuntary, so it's really going to the bathroom when you don't want to go. This can happen and occur when you're driving home from work and you have to pull off the road and find a bathroom. Or it can happen, you get up frequently at night, or when you're laughing, coughing, sneezing. So one of the things that's important to note is it is not a disease, urinary incontinence. It's a medical condition and it can be treated.
Okay. Now, what causes it?
Well, that's a good question. So let's just talk about the normal bladder. It's like a balloon-like structure, and then it has a tube going down. It's called a urethra. And then there's a rubber band of muscles around that, and it acts like a rubber band. So it closes it when you don't want to go to the bathroom, and it expands when you do go to the bathroom. And then there's the urethral support system, pelvic muscles, that support the bladder and then support other organs. So there are a number of causes for urinary incontinence. Childbirth. So one of the things that happens when you are having a baby, the uterus is right on top of the bladder and it puts pressure on the bladder. And over time that can weaken the muscles. So this urinary incontinence can occur immediately after childbirth, or it can occur years down the road. Age also is a factor. So as we grow older, women lose levels of estrogen. That's a hormone. Estrogen acts like a natural, it helps the bladder stay healthy and helps muscles stay healthy and elastic. So as we get older, that naturally decreases. And some other reasons may be obesity, overweight, that's putting pressure on the bladder. Exercising, such as gymnastics, running, can put pressure on the bladder. And those are several reasons.
So are there different types of urinary incontinence?
There are a number of them. Stress is the most common. That's, once again, what we were talking about, childbirth, things that put pressure on the bladder. Urge incontinence is just you have to go to the bathroom urgently. Your bladder may not be filled, but something's sending a signal to your brain. Even the sound of water could make you go bathroom. And then we have overflow incontinence, where the bladder just overflows and leaks. The person is not able to empty their bladder properly. And then we have functional incontinence. So functional incontinence is the fact that they have maybe an underlying neurological disease such as Parkinson's. And then we have a mixed, we have urge and also stress together that cause incontinence.
Good news is there's some treatment options. Let's talk about them.
There are. What's amazing is that about 1 in 3 women will experience urinary incontinence in their lifetime, but only 50% of those women seek help for it. So it's kind of like a silent epidemic, as you were mentioning. And once a person does decide, it takes them about 6.5 years to seek help from their healthcare provider. So I'm here to tell you, one, it's not a normal part of aging. You can get treatment and it can be curable. So it's very important to go seek help from a healthcare provider. At the Bellin Pelvic Center, we have a board-certified urogynecologist, Dr. Chun, who will sit down, discuss your symptoms with you, and put together a treatment protocol plan for you.
So what are some of the treatments?
Well, there's behavioral modification. Usually that's used for urge incontinence. There's exercises such as Kegels. People have heard and familiar with that. And the evidence has shown if they're done properly, it really can help urinary incontinence. There's also medications, special devices we use. We use electrical stimulation, where women come to the clinic and we do sessions, 4 to 12 sessions. That's very effective. Also surgery, we have very minimal invasive to invasive. Once again, that will be discussed with your healthcare provider if that would be a solution.
And why is it important to treat this? If it's left untreated, what can happen?
Well, it's a good question. Left untreated, you can have rashes, skin infections, emotional distress, Also, you can have self-imposed isolation. Often women come into our practice and talk to us about how they've stopped doing their hobbies, what they love to do. They travel less. You know, when they go to work, they have to carry extra pants and underwear and pads. So they just self-inflict social isolation. So one of the important things to know is there is help. They can seek help to talk to their healthcare provider, get a referral to the pelvic center, talk about the solutions that are out there. It's very treatable is one of the main important points I'd like to make.
Yes, and you have. Thank you so much for coming in. Let's talk about how you can get in touch with the Bellin Health Pelvic Center. Head to bellin.org/pelvic.
Or give them a call, 920-468-3444. Thank you so much for being here.
Thank you very much.
We'll be right back.